Welcome back, everyone. I'll just let the last few people come in. Can you guys hear me okay? Okay. Excellent. So I'm pleased to invite to speak today Dr. Luanne Metz, who's the local member of Legislative Assembly for Calgary Varsity. She invited another patient member of this group to give some brief remarks, and I just wanted to also share for transparency that 2 months ago, the Honorable Adriana Lagrange, Minister of Primary and Preventive Health Services, was invited. They aren't available, but they have arranged to speak with us at a future time. And we also invited the Honorable Matt Jones, Minister of Hospital and Surgical Services and MLA for Calgary Southeast, and they were also not available. So Dr. Metz is like I said, member of Legislative Assembly for this region. She has been involved extensively with leading policy development and consultation to improve healthcare across Alberta. And she is also a professor emerita of the University of Calgary Cummings School of Medicine. And we're so pleased you could join us. Thank you.
Thank you, Renita. This is kind of like being home. I mean, I sat in this theater, didn't look like this then, back in 1979 when I started medical school here. So I know this well. I've been a member of the Hotchkiss Brain Institute and led the Division of Neurology for several years. And my main area was multiple sclerosis as a neurologist. And my whole career was about building our multidisciplinary clinic, which was really one of the best in the world. And I know the value of a clinic for people that have a disorder. And the multidisciplinary teams or interdisciplinary teams are critical. If you don't have that, what you end up with is a physician being that lead point, maybe disconnected with a physiotherapist if people can afford to pay a physiotherapist, and online information, much of which is marketing and not true. And we need to come together and have these teams because as a physician, there is so much that I wasn't the best one to do, absolutely. And I knew that, and my patients knew that. And when we had our interdisciplinary team, everyone there plays their role and works together. And we have many perspectives. And we know that the patients highly valued this because over 95% of people in Southern Alberta came to our clinic because we offered something, because it was the team, not just the physicians. My current role, so I moved out of medicine to become an MLA. I'm with the NDP caucus, and my role is to chair something called the Future of Healthcare, which is looking at what we should be doing in healthcare and what the NDP will do should we form government. Share things with this government, but they don't take them up. And so we will listen to experts, we will deliver publicly funded and usually publicly delivered, although not everything needs to be publicly delivered, healthcare. And over the last year and a half, mostly what I've been doing is meeting with different groups of patients, experts, advocacy groups, academics, and health leaders, former health leaders, many people to really look at what we should be doing in our future. There is no question that we need to be moving towards team models of care delivery. And most of that you'll see is focusing around team models in primary care, but we need team models in specialty care as well, because there are conditions that there's no way a primary care provider is just going to have the number of patients that they wouldn't be up, and they can't keep up on everything. Therefore, breadth of knowledge, and we need specialists. And one of the wonderful things about the clinic that Dr. Minocha has built is that they also learn from you and build what can be known about a condition and are a resource out there to other community providers, so that you don't only have to come to this clinic, but if you live far away, your physio could talk to a physio who has expertise in this condition. So these are things that will be critical for the future. It's absolutely one of the things that we will be moving towards. And I just thank you all for letting me here today. I'll be sticking around after if people have some questions for me. Thank you very much.